Hi everyone, my name is Elena Quintanilla. Today my topic is a suPAR biomarker for chronic kidney disease. Definition: a chronic kidney disease slowly gets worse and symptoms may not appear until the kidneys are severely damaged. In the last stage that approaches renal failure, you may notice the symptoms caused by waste and accumulation of additional fluid in your body.
Chronic kidney disease, or CKD, describes the gradual loss of kidney function. The primary function of your kidneys is to filter your blood, to remove waste and water. However, over time, conditions like diabetes, high blood pressure, or even other diseases like autoimmune and congenital can damage the kidneys and weaken their ability to filter waste and water from your blood. Now, depending on the disease that is causing the kidney dysfunction, you may be diagnosed with conditions like diabetic nephropathy, polycystic kidney disease, hypertensive nephrosclerosis, and when we use the term CKD, it applies to all of these conditions. The two most common causes of chronic kidney disease are high blood pressure and diabetes. So people with these conditions are at risk for CKD. Other people at risk include those with a family history of renal disease and those who take a lot of painkillers, even over-the-counter products like ibuprofen. CKD tends to be a silent disease, and in the early stages of it, there are usually no symptoms. As the disease progresses, some symptoms may include changes to how often you need to urinate, feeling tired or drowsy, losing appetite, swelling in the feet and in the hands, a feeling of itchiness or numbness, nausea, vomiting, muscle cramps, and darkness of skin. Often, kidney diseases are discovered through routine testing of blood or urine. The major blood test that is performed to diagnose CKD is the serum creatinine, which estimates how well the kidneys are removing waste products. The serum creatinine, along with other factors such as age, race, and gender, are used to estimate the glomerular filtration rate, or GFR, which is a measure of kidney function. Unfortunately, there is no cure for CKD, but treatment is designed to delay the progression of the disease. There are some medications that can help slow down the progression of the disease, but the main interventions consist in controlling the underlying condition. People with reduced kidney function should see their doctors regularly to keep their blood sugar and blood pressure levels under control and avoid taking painkillers or smoking. Treatment options for patients with very low kidney function or in the end stages of CKD include dialysis and kidney transplantation.
Application in medicine. Some conditions that may put you at greater risk for kidney disease include diabetes, hypertension, heart disease, have a family member with kidney disease, be over 60 years old. Pros and cons. Early detection can help prevent the progression of kidney disease, and these disorders are the third most common type of kidney disease, such as glomerulonephritis, a disease that causes inflammation and damage to renal filtration units.
It's a hot day, and you've just downed several glasses of water, one after the other. Behind the sudden urge that follows are two bean-shaped organs that work as fine-tuned internal sensors. They balance the amount of fluid in your body, detect waste in your blood, and know when to release the vitamins, minerals, and hormones you need to stay alive. Say hello to your kidneys. The main role of these organs is to dispose of waste products and to turn them into urine. The body's 8 liters of blood pass through the kidneys between 20 and 25 times each day, meaning that together, these organs filter about 180 liters every 24 hours. The ingredients in your blood are constantly changing as you ingest food and drink, which explains why the kidneys need to be on permanent duty. Blood enters each kidney through arteries that branch and branch until they form tiny vessels that entwine with special internal modules called nephrons. In each kidney, 1 million of these nephrons form a powerful array of filters and sensors that carefully sift through the blood. This is where we see just how refined and accurate this internal sensing system is. To filter the blood, each nephron uses 2 powerful pieces of equipment, a blob-like structure called a glomerulus, and a long stringy straw-like tubule. The glomerulus works like a sieve, allowing only certain ingredients, such as vitamins and minerals, to pass into the tubule. Then, this vessel's job is to detect whether any of those ingredients are needed in the body. If so, they're reabsorbed in amounts that the body needs so they can circulate in the blood again. But the blood doesn't only carry useful ingredients. It contains waste products too, and the nephrons have to figure out what to do with them. The tubules sense compounds the body doesn't need, like urea, left over from the breakdown of proteins, and redirects them as urine, out of the kidneys and through 2 long sewers called ureters. These tubes empty their contents into the bladder to be discharged, ridding your body of that waste once and for all. There's water in that urine too. If the kidney detects too much of it in your blood, for instance, when you've chugged several glasses at once, it sends the extra liquid to the bladder to be removed. On the other hand, low water levels in the blood prompt the kidney to release some back into the bloodstream, meaning that less water makes it into the urine. This is why urine appears yellower when you're less hydrated. By controlling water, your kidneys stabilize the body's fluid levels. But this fine balancing act isn't the kidney's only skill. These organs have the power to activate vitamin D to secrete a hormone called renin that raises blood pressure, and another hormone called erythropoietin, which increases red blood cell production. Without the kidneys, our bodily fluids would spiral out of control. Every time we ate, our blood would receive another load of unsifted ingredients. Soon, the buildup of waste would overload our systems and we'd expire. So each kidney not only keeps things running smoothly, it also keeps us alive. Lucky then that we have 2 of these magical beans.
Issue applied in Ecuador. Dr. Mosquera, head of the nephrology department of the Luis Bernaza Hospital, revealed that the risk of developing chronic kidney disease is greater in the female population, according to some studies, and an average prevalence of 14% in women and 12% in men. And conclusion, biomarker panels will likely be useful for assessing the duration and severity of kidney disease and for predicting progression and adverse clinical outcomes for chronic kidney disease. These include a similar plasma panel and urine panel. It will be important in future studies to validate the sensitivity and specificity of this biomarker panel in clinical samples of large cohorts and in multiple clinical situations.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. Chronic kidney disease is a broad term that includes subtle decreases in kidney function that develop over a minimum of 3 months. In contrast, acute kidney injury refers to any decrease in kidney function that happens in less than 3 months. Now, the kidney's job is to regulate what's in the blood, so they might remove waste or make sure electrolyte levels are steady, or regulate the overall amount of water. And they even make hormones. The bottom line is that the kidneys do a ton of stuff. Blood gets into the kidney through the renal artery, and once inside, it goes to tiny clumps of arterioles called glomeruli, where it's initially filtered. And the filtrate, which is the stuff that gets filtered out, moves into the renal tubule. The rate at which this filtration process takes place is known as the glomerular filtration rate, or GFR. In a normal, healthy person, this is somewhere around 100 to 120 milliliters of fluid filtered per minute per 1.73 meters squared of body surface area. This value is slightly less in women than men, and it decreases slowly in all of us as we grow older. One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidneys start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephron's glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1, or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts. And then those mesangioblasts secrete extracellular structural matrix. This excessive extracellular matrix leads to glomerulosclerosis, which is hardening and this creates an obstruction that makes it difficult for blood to leave the glomerulus, and increases pressure within the glomerulus, which leads to hyperfiltration, essentially pushing more fluid through. In response to this high pressure state, the supportive mesangial cells secrete more and more structural matrix, which expands the size of the glomerulus. Over many years, this process of glomerulosclerosis once again diminishes the nephron's ability to filter the blood and can lead to chronic kidney disease. Although diabetes and hypertension are responsible for the vast majority of chronic kidney disease cases, there are other causes as well, including systemic diseases like lupus and rheumatoid arthritis, which can also cause glomerulosclerosis. Other causes, though, include infections like HIV, as well as long-term use of medications like NSAIDs, and toxins like the ones in tobacco. Now, normally, urea in the blood gets excreted in the urine. But when there's a decreased glomerular filtration rate, less urea gets filtered out, and therefore it has nowhere else to go besides the blood. And so it builds up in the blood, which is a condition called azotemia. Azotemia can cause general symptoms like nausea and loss of appetite. But as urea levels really build up, they can affect the functioning of the central nervous system, causing encephalopathy. This results in asterixis, a tremor of the hand that kind of resembles a bird flapping its wings. As calcium levels in the blood fall, parathyroid hormone is released, which causes the bones to lose calcium. Over time, this resorption of calcium from the bones leaves them weak and brittle, a condition known as renal osteodystrophy. The kidneys also release key hormones. For example, normally when the kidneys start sensing a lower than normal amount of fluid getting filtered, they respond by releasing the hormone renin.